Hi, I'm Christopher Saslow, the Associate Director for Patient Care Services here at Gulf Coast Veterans Healthcare System. This week, I'd like to start by welcoming the new staff coming on board to our acute care med-surg area, as well as in our community living center. We want them to feel welcome, and I'm sure that you'll do your very best to make them feel just that. I'd also like to talk about the Nursing Professional Standards Board. For those of you that are registered nurses and licensed practical nurses, it is important to recognize that what you do each and every day is captured and utilized in reviewing your annual proficiency or performance appraisal, depending upon what your title is. If you're a Title 38 or an RN, it's very important for you to understand what your functional statement says and what it is that's expected of you to sustain a satisfactory or to seek a highly satisfactory or an outstanding as a Nurse 1, a Nurse 2, or a Nurse 3. The higher you go in the platforms, the higher your expectations are as a nurse. LPNs have the ability to come in at a lower grade, such as a GS4. However, it's expected that very quickly they should be working at the full performance level, which is a GS6. For those individuals that are in highly specialized area, there is a GS7 that is role-specific, not person-specific. If you've not had an opportunity to attend one of the Nursing Professional Standards Board educational opportunities, I invite you to seek them out and to talk to your manager about perhaps having an in-service in your area. I'd also like to talk about the approach of Nurses Week, coming up very soon. May 6th through May the 12th is National Nurses Week, and I want you to have the opportunity to attend those functions that are specific to your areas and your units. Please check with your nurse manager or your chief nurse to find out what's coming up in your neck of the woods soon. Also, we've sent out an agenda so that all staff will have information available to them to know what's going on each and every day. There are going to be days where we have recognitions and awards, and I want staff to take the opportunity to help congratulate your fellow nurses in the outstanding jobs that they've done throughout the year. And speaking of outstanding performance, I'd like to go ahead and recognize several nurses now. From our performance improvement and unit dashboards information, we have a number of nurses that have hit 100% documentation for their PRN effectiveness for the second quarter in FY16. There are 4 nurses in the blind rehab: Rachel Duncan, Susan Lindsay, Lori Fraisch, and Melissa Reed. Each of those individuals has reached 100%. In the Community Living Center, Danielle Dean and Margaret Jaffron have also achieved that 100% status. Please take the moment and congratulate your peers and help identify what they're doing that you might do differently to reach that same level of success. On another topic, I'd also like to talk about our stroke education. As you know, stroke is a serious condition that requires a rapid and informed response by our healthcare teams. VHA Directive 2011-038 discusses the treatment of acute ischemic stroke and requires our facilities to make available a comprehensive web-based education source on stroke to the healthcare professionals. While TMS has many good educational opportunities, Gulf Coast Veterans System has identified the TMS course VA 14554 as a highly effective in providing information on the signs and symptoms of stroke, risk factors for stroke, complications from the stroke, and treatment and response protocols for stroke. Please take a moment and review this training and find out what you might be doing differently for those individuals that are at risk. I'd also like to take an opportunity to give a big kudos on a recent VISN survey just this past week in our reusable medical equipment and sterile processing done by the VISN team. It was a very comprehensive survey. We were recognized in our sterile processing system as having 11 best practices that will be shared throughout the VISN. The team did identify several opportunities for improvement in the clinical arena when it comes to the using of first in, first out rotation of sterile supplies and the need to avoid overstocking drawers that might risk the integrity of packaging of such instruments and supplies. Please check your areas to make sure that we're not at risk for expired supplies, nor the integrity breaches of any protective wrappings of sterile supplies you might be using. Finally, I'd like to talk about the SAIL report, which is the Strategic Analytics for Improvement and Learning. I spoke last time about this, and I wanted to make you aware that this week will be our next SAIL report coming out. While I suspect that we will be having some additional challenges compared to our last quarter, I want to emphasize how important it is for you to understand that VA as a whole is measured on these types of opportunities, but these measurements and these performance measures translate to how we're caring for our veterans. Every measure and every outcome that we seek to expand or excel in is attached to a human being, and those are the individuals that we care for each and every day. I want you to take a moment and review your performance measures with your manager and your chief nurse, and start to identify how you as an individual and your team can impact and improve in those performance measures. We'll be showing you some slides in the future as this week's SAIL report comes out for the quarter, and help you to understand how big VA and Gulf Coast Veterans Healthcare System is measured in terms of success and opportunities that we have to grow as an organization. Thanks very much for your attention today, and I hope you have a great week.